So although we've identified lots of different pathways that are aberrantly expressed in CML, and some of those pathways do have drugs that we can use to target them, often these drugs come with additional side effects, and these side effects seem to be amplified when you give them in combination with the tyrosine kinase inhibitor. When we look at co-targeting within CML, we're trying to look at different things. So, for example, if you're trying to co-target for treatment-free remission, you need to be really careful that patients are not getting any additional side effects. And actually, those patients that are doing incredibly well can be quite reluctant to take on additional therapies that may have additional side effects or result in more visits to hospital. It's a different situation for those patients that have TKI resistance, where they've maybe cycled through 3 or 4 TKIs and still don't have an optimal response. I think for those patients, combining therapies is a really important potential option that may obviate the need for a future stem cell transplant if we can find a combination that works. But again, we need to find kinder therapies that are not causing side effects. And then the other group of patients is those patients with blast phase CML, and we know for those patients that we need to give multi-drug regimens in order to get a remission, because most of these patients are BCR-ABL independent in terms of their disease. Moving on to think about what these targets might be, we have identified that there are specific pathways that are deregulated, such as P53 and c-Myc, for example, and also metabolic pathways, but actually finding drugs that target these pathways with a minimum of side effects is quite difficult. There has been a huge interest recently, especially for treatment-free remission, in looking at the bone marrow microenvironment and understanding the immune system and how that changes within CML, and probably going forward, understanding and potentially using that the immune system to improve responses is probably where we would go in the future, I think, and hopefully those treatments would be kinder. I think for blast phase CML, especially lymphoid blast phase CML, if we compare that with Philadelphia chromosome positive ALL, we've seen huge advances in treatment, and hopefully those treatments that have been such a success for a Ph positive ALL will make a difference for those patients with lymphoid blast phase.